Radiologic contrast media. Here is our trigger with the title Colorblind. In plain radiographic examinations, soft tissue structures don't usually appear because of their low attenuating capability. To increase X-ray attenuation, substances can be introduced into these soft tissue structures. First, I will define what is contrast media. It is a chemical substance of very high or very low atomic number or weight. Therefore, it increases or decreases the density of the organ under examination. It allows visualization of structures that cannot be seen well or at all under normal circumstances. This contrast media can also be introduced in our body via enteral parenteral route to visualize certain structures that are not seen in plain radiography. So basically, if gusto nato nga ang structure of interest kay more visible, that's the time na magamit ta og contrast media. It is also used to see vascularity of certain lesions in CT scan and MRI. So this is what the contrast media looks like. Why contrast media is needed? Contrast media is needed because soft tissue has a low absorption or interaction ratio, which is true because when X-ray penetrate tissues, dili tanan maabsorb, some of the X-ray will pass through the tissues and produce diagnostic image sa film. So kini ato ang soft tissues, na sila lahi-lahi nga absorption, and it will depend upon the thickness, atomic number, and density. Sa thickness, kung mas baga ang anatomic part, for example, ato ang bones, so taas pud ang absorption. Sa atomic number, kung taas ang atomic number, taas pud ang absorption. So the higher the atomic number, the more whiter ang appearance sa contrast. Sa density, however, if two organs have similar densities and similar atomic number, dili siya possible nga ma-distinguish ang organs sa radiograph. It is because no natural contrast exists. Types of contrast media. We have here positive contrast and negative contrast. Under positive contrast na ay iodine base and barium sulfate or katong barium base nga materials. Sa negative contrast na ay katong air and carbon dioxide and etc. Negative contrast are substances having lower atomic number than the surrounding tissues and appears black on the radiograph. It allows X-ray to penetrate structures more easily. Examples are air, carbon dioxide, and helium. We all know nga sa air, it absorbs less radiation, consequently radiolucent, so their image on the film appears black, same as with carbon dioxide and helium. The negative contrast agents reduce the atomic number of the area to be demonstrated. In addition to this, the density over hollow organs can also be reduced by filling it with air or gas providing negative contrast. These types of contrast media will have a little attenuation of the X-ray beam. So as you can see in these pictures, the structures appears black. Positive contrast are substances having higher atomic number than the surrounding tissues and they usually appear white on the radiograph. They will appear white because the contrast absorbs X-ray. Examples are iodine base, barium base, and gadolinium base. Sa iodine base, it is classified into two, water-soluble and non-soluble. When we say water-soluble, muna silang ma-dissolve sa water and ang non-soluble dili ma-dissolve sa water. If the material can be dissolved more sa water, the more paspas pod ma-excrete sa patient ang contrast. Barium base. It is commonly used when diagnosing inflammatory conditions sa ato ang lower GI tract. It is taken by mouth or orally, pwede po siya rectally, and is available in several forms. Pwede siya powder, nga sagulan nimo og water before administration, and then liquid, paste, and tablet. Gadolinium base, often used sa MRI examinations. It is less likely to produce allergic reactions than the iodinated base materials nga gagamiton sa X-ray. Kini diay iodine base, alternative ni siya sa mga patient nga bawal sa barium base. The positive contrast agents increase the atomic number of the area to be demonstrated in relation to the surrounding tissue. There are examinations that utilizes contrast media. We have angiography, intravenous urography or IVU, intravenous pyelography or IVP, computed tomography, interventional techniques, GI series, and other examinations. Characteristics of good contrast media. First, easy to administer. Stable compound. It means it will not dissociate into toxic ions. When injected, the media concentrates in areas required. The agent should have rapid elimination. The agent should not be carcinogenic. The agent should have a viscosity appropriate to the patient when introduced. The agent should cause minimal distress to the patient when introduced, and the agent should be cost effective. Methods of administering contrast media. First is oral method. From the word itself, the contrast media is taken by mouth. Parenteral method, the contrast media introduced via injection. Intramuscular method, the contrast media is injected through our muscles. And then intravenous method, it is injected through our veins. And then intrathecal method, the contrast media is injected through the meninges of the spinal cord. So there are side effects of contrast media, specifically sa barium-based contrast materials, na siya'y mild and moderate. Sa mild side effects, it includes stomach cramps, diarrhea, nausea, vomiting, and constipation. Under sa moderate side effects, na ay hives, itching, red skin, swelling of the throat, and difficulty breathing or swallowing. Sa iodine-based contrast media pod, na ay mild reactions and moderate. Sa mild reactions includes nausea and vomiting, headache, itching, flushing, and mild skin rash or hives. Moderate reactions include severe skin rash or hives, wheezing, abnormal heart rhythms, high or low blood pressure, shortness of breath, or difficulty breathing. So, sa contrast media na ay mga terminologies like osmolarity, viscosity, and miscibility. Sa osmolarity, it is the measurement of the number of molecules and particles in a solution per kilogram of water. So, to simply understand osmolarity, it is the degree of chemical composition nga mo separate sa contrast medium. So, kung ang contrast media naa inside sa ato ang body, mag-breakdown na sila, so dako ang chance nga magka-allergy ang patient. When we say breakdown, ang mga molecules and particles or ions sa contrast media kay mga bungkag. Ang osmolarity ay high and low. When we say high, dali ra mag-separate ang ions from the contrast medium. Those ions mapilit sa ato ang blood vessels, thereby causing allergic reactions. Kung low osmolarity, dili siya diretsyo mo separate ang ions. So it means intact ra siya. So low pud ang chance nga magka-allergy ang patient. Viscosity describes the thickness or resistance to flow of a contrast agent. The thickness of the contrast agent is related to the concentration, the size of the molecules in a specific contrast agent. So, kining viscosity, muni ang iya ang pagka-pilit or pagka-sticky. No? So, the more viscous, the more dugay mo pilit sa blood vessel, the more pud white ang appearance, but dugay pud ma-excrete sa patient. Miscibility, contrast agent should be readily miscible with blood. So, dapat readily na siya ma-mix with blood para mas efficient ang contrast media. Now, let's proceed to guide questions. Number 1. How does the radiographic anatomy in Figure A differ from Figure B? The radiographic anatomy in Figure A is not clearly visible compared to Figure B because it is only a plain radiograph of the abdomen. Anatomical structures in Figure B appears clearer because of the contrast media introduced into the body. The colon and the rectum are visualized on Figure B compared to Figure A. Number 2. What makes the soft tissue anatomy in Figure B appear more detailed than Figure A? Soft tissue anatomy appeared more detailed in Figure B rather than with A because contrast media is used in Figure B. Adding contrast media to a body part increases its tissue density compared to the structures around it, making it more visible and detailed compared to other radiographs where contrast medium is not used. Number 3. What are these substances that are introduced in the soft tissue structures of the body? These substances that are introduced in the soft tissue structures of the body are called contrast media or contrast agents or contrast materials. Contrast media are solutions or gases introduced into the body to provide contrast in the radiograph between an organ and its surrounding tissue. Lastly, how do these substances alter the appearance of these soft tissue structures in the radiograph? So these substances alter the appearance of these soft tissue structures in the radiograph by enhancing its contrast and density for the radiologist to clearly identify the organ from its surrounding tissues and to distinguish normal from abnormal conditions. So that's it. Thank you for listening.